babies are born healthy, but as they are so small, they need great care and attention to survive. It is better to have your baby delivered at a health centre, but if you can't, we are going to explain in this film how to care for a baby as soon as it's born and how to recognise when it needs to be taken to a health centre for treatment.
We kept our son warm with lots of clean clothes, especially around his head, where babies lose a lot of heat.
My daughter did not cry when she was born. The midwife checked and she was not breathing. She had to help her breathe by doing resuscitations, which saved her life.
We're going to be hearing advice from experts Comfort Momo and Janet Val. First up is Janet.
Today, I'm going to be demonstrating using this pretend baby. It's much easier doing it this way rather than using a real baby. I'm going to show you what needs to be done as soon as the baby is born. It is important that you do this in the correct order. It is very important to keep newborn babies warm following the birth. If you need to, shut all the doors and windows to keep the room warm. Before the baby is born, wash your hands thoroughly and put gloves on. This can prevent germs and infection from being spread, which can make people really ill. To help a baby straight after birth, you will need the following. Number 1, new clean razor or scissors that have been cleaned in boiling water to cut the cord. Putting scissors in boiling water and keeping them there for at least 10 minutes, which is roughly the same time as this film, will kill the germs. Number 2, 2 clean ties. These can be pieces of cloth to secure the cord with. Number 3, at least 2 big clean cloths to keep the baby warm with. Number 4, a flat, dry, clean surface in case you need to resuscitate the baby. Number 5, you will also need a second person to help you, if necessary. When the baby is born, place it in the mother's arms or on her belly. Dry the baby with a warm, clean towel or piece of cloth and check that the baby is breathing as you dry it. Wipe fluids from the eyes, nose and mouth with clean cloth. Remove the wet cloth and cover the baby's head and body with dry clothes. While drying the baby, check to see if it's breathing and crying. Is its face and body pink? Is it moving and active? If the answer is yes to all these questions, then the baby is well. Keep baby skin to skin with the mother, keeping them both covered with dry clothes or blanket. If the baby doesn't cry, is floppy, or has blue or grey skin, and you cannot see its chest moving, then this means it is not breathing. Quickly cut the cord, wrap the baby in a dry cloth, and ask someone to come and help if you are on your own. Place the baby on a flat, dry, and clean surface lying on its back, making sure its head is covered, but mouth and chest are clear. It is important that a baby who is not breathing receives help to breathe immediately, otherwise it won't survive. Check the mouth and nose to make sure they are clear, but don't put anything in the baby's mouth. The baby may start to breathe if you open its airway by placing the baby's head parallel with the flat surface. Putting a folded cloth the thickness of 2 fingers underneath the baby's shoulders can keep it in the correct position. Check if the chest rises. If the baby still isn't breathing, Keep the baby's head in the neutral position and start gently breathing into its mouth and nose. Put your mouth over the baby's nose and mouth. Breathe gently into the baby's mouth and nose, using only the breath in your cheeks. Give 5 slow breaths, counting to 3 slowly in your head during each breath. Look to see if the chest is rising at the same time you give the breaths. If you do not see the chest rising as you give these 5 breaths, check the position of the baby's head and try again. If a second person is available to help you, ask them to keep the baby in the correct position. Repeat your breaths into the baby's nose and mouth, looking to see if the chest rises. Once you have seen the chest is rising, continue to give short, gentle breaths into the baby's nose and mouth until the baby begins breathing regularly on its own. Try to give 30 breaths in 1 minute. If you have been doing this for 10 to 15 minutes and the baby has not begun to breathe on its own, the baby is unlikely to start breathing and it is likely to die. It is probably better to stop giving any more breaths and try and get help from a health worker if possible. A baby who has been resuscitated needs to be closely watched. It also needs to breastfeed immediately and be kept warm. It should be taken to a health worker immediately.
She was so grey and floppy. We cleaned her and put her in a dry cloth and gently moved her head. Then she started to breathe and began to cry. I was happy. I cried too. The midwife taught us how to help our babies if they are born when they are not breathing. Thanks to these midwives, they make me help my boy.
So now you know how to assess a newborn baby and how to help it if it is not breathing. Now let's meet Comfort, who will show us how to safely cut the baby's cord.
If the baby is breathing and well, you can pass it straight to the mother for warmth, breastfeeding, and cut the cord a few minutes later. You need a clean new razor blade or scissors that have been boiled in water. Wash your hands with soap and water again. Put new gloves on. Use a clean thread to tie the cord tightly, at least 2 finger width away from the baby's belly. Then tie a second clean thread 2 finger width away from the first one. Cut the cord between the ties using a new razor blade. Do not put anything on the stump unless a health worker tells you to, and leave it dry and uncovered. Check for swelling, redness, or bleeding over the next few days until the stump falls off. If the baby needs help with the stump, it should be taken to health worker straight away.
It's really very important that newborns are fed soon after birth. Breastfeeding is essential. Here's Comfort to explain why.
The first feed helps prevent lots of illnesses, and the first breast milk, which is a yellow color and called colostrum, protects the baby against infection. Breastfeeding helps the mother deliver the placenta. Another thing to remember is you don't need to wash the baby within the first day. The baby should also have started to pass wee or poo by the end of its first sunrise and sunset.
So now you know how to check and look after a newborn baby. Comfort is going to explain what to look out for in the first few days of a baby's life.
Although babies may sleep a lot during the first few weeks after birth, they should wake up to feed at least 8 to 12 times from one sunrise to the next. The baby may sleep between feeds, but should be alert when awake, responding to noise and touch, and should suckle well at the breast. If the baby does not wake up to feed regularly, it could be unwell. It should be taken to health worker straight away. Other signs and symptoms that the baby is unwell are: the baby is small, it has trouble feeding, it has less energy than normal, the baby feels hot or cold, the baby has trouble breathing, the baby suffers from fits, or it has an infection of eyes, cord, or skin. If the baby is unwell, it should be taken to health worker straight away. So now you know what danger signs to look out for. Even if baby looks well, it's really important to take the baby to a health center to be seen by a health worker within the first week following birth. But ideally, within the first day, so that the baby can have routine check and medication.
Let's end by reminding ourselves of the information that we've seen in this film. Once the baby is born, place it in the mother's arms or on her belly. Dry it with a warm, clean towel or piece of cloth. While drying the baby, check to see if it's breathing or crying. Are its face and body pink? Is it moving and active? If the answer is yes to all these questions, the baby is well. Remove the wet cloth and cover its head and body with dry cloths. Clamp and cut the umbilical cord with a clean, new razor blade or scissors that have been boiled in water. Help the mother to breastfeed as soon as possible after the baby is born, within the first hour of birth. Keep it skin to skin with the mother, keeping them both covered with dry cloths or blankets. But if the baby does not cry, it is blue or grey, or is limp and floppy, check to see if it is breathing by looking to see if its chest is rising. If it isn't, you will need to help it breathe or it will not survive. Right, well, I certainly feel better prepared to look after a newborn baby. Do you? I hope you enjoyed watching.
My baby took a long time to breathe and needed a lot of help. But she's perfect and healthy now, thanks to the nurse.
My baby needed resuscitation with someone breathing inside his mouth. He's now a strong, healthy baby.
We are lucky we had the help from the village birth attendant to ensure our baby was delivered safely and looked properly after birth.
My baby did not breathe. They moved her head to a good position. This helped her to breathe alone. I'm lucky. They knew to do this.